The arrow clasp is adapted to the interdental area. Where the tip of the arrowhead will be referenced usually needs to be prepared. Cut approximately 1 millimeter of interdental papilla from the interproximal space and simulate the margins of the two adjacent teeth. This is the non-connective tissue at cervical crown level. For some models, adequate undercut is present. Thus, minimal to no carving may be necessary. Place the tip of the arrowhead at the papilla reference. Arrow form may need adjustment to prevent sides of arrow from interfering with teeth, preventing the tip from engaging at papilla reference. Hold the center area of the arrow with 1/34 pliers and increase bend angle. Hold arrow clasp wire in place by pressing with thumb or finger against model. A 1 millimeter relief may be present between the top of the arrow bend and occlusal embrasure of model. This gives a better angle of tip of arrow into undercut reference. Caution must be taken not to have this bend protrude too far buccally, especially against the lower dentition where occlusal interference from upper buccal cusp could exist. Mark the wire where it last contacts both teeth at the same reference. At this point, wire will be adapted to fit tightly between teeth as the wire crosses occlusal surface. At mark, bend wire towards tissue using the tip of the 1/34 pliers. Check previous bend to make sure wire lays flush to anatomy across occlusal surface. Mark the wire at lingual occlusal contact, which here is the last spot wire contacts teeth. At mark, bend wire towards tissue using the tip of the 1/34 pliers. Place the wire on model to evaluate fit. If previous bend was too big, then wire will push against model and lift wire away occlusally. Adjust if needed. Here the wire is too long and hitting against middle of palate, which is not allowing it to fit flush across the occlusal surface. Cut wire approximately 12 to 15 millimeters below gingival margin. Mark the wire at the interdental papilla reference. At mark, the wire is bent up to prevent tissue contact. The wire should be approximately 1/2 to 1 millimeter away from the palate. Create this bend using the tip of the 1/34 pliers. Mark the wire after the up bend to contour wire 1 millimeter away from the tissue. Adapt wire using 3-prong or 1/34 pliers starting at mark. Place the wire on model to evaluate bends. Make sure wire maintains a 1 millimeter space from tissue. An acrylic retention bend should be incorporated into the wire end. This will prevent the wire from pulling out of the appliance. This bend or series of bends must be parallel to the tissue, approximately 1 millimeter away. The open wire end should face the anterior model segment to identify right or left side that it was adapted. Position the plier tips pointing towards the tissue. When creating the zigzags, start at the end of the wire and bend it in a mesial direction. Rotate the pliers and create a second distal bend above the first. Again, rotate the pliers and incorporate a mesial bend immediately above the last bend. The open end of this wire should be pointing towards the anterior teeth, or midline. Place the wire on model to evaluate bends. Make sure wire maintains a 1 millimeter space from tissue. Before acrylic is applied, wires will be secured to model with wax that is applied to the facial surface. This will not be done until all wires have been completed.